All right, so say welcome everybody to our Say Something Strong campaign. My name is Jason Smith. I am a program manager here at Durham County within the Division of Health Education, and we're so excited just to be able to talk to you guys regarding our Say Something Strong campaign. I have some wonderful people with me just to be able to talk a little bit about our Say Something Strong campaign that you guys probably have seen or heard about it. If you have not heard about our project that's out actively out for applications, well, hopefully now you've heard about it. We're super excited to talk to you guys, to be able to feed question that you guys may have. Before we get started in this, I'm going to ask Nicole. She's here with us, and she's going to give us a little bit of a program overview around who we are, and then she'll pass it on to our other guest, Angel, and then she'll also be in to share a little bit about her organization and what she does there.
Right. So thank you, Jason, and thanks again, everyone, for attending our Bull
Of
City
course.
Strong and Say Something Strong information session. Durham County Public Health has funded a health literacy project named Bull City Strong. Bull City Strong is a community-based partnership that focuses on reducing the severe effects of COVID-19 among Black, Hispanic, and other historically marginalized populations in Durham County. Partners include Latin 19, Project Access of Durham, North Carolina Central University, Durham County Department of Public Health, Pillar Consulting, and a host of other community-based partnerships throughout Durham. Say Something Strong is a project to share stories of community health and resilience in Durham during the COVID pandemic. This funding opportunity is available for creative projects that reflect our work to resolve health equity issues resulting from COVID-19 through artists, journalists, and social influencers. This session aims to answer many of the questions we have received so far for this month regarding this campaign. Now, before we get started, I would like to give the opportunity for Angel Dozer from Be Connected Durham to introduce herself.
Well, hello, good people. I'm Angel Dozier. Thank you so much for this opportunity, Durham County Public Health. I've been really excited about working with the county and the city in general over the last several years. So I'm Angel Dozier. I'm the founder of Be Connected Durham. And Be Connected Durham and beyond is about making connections across the board using the arts to provide messaging and what we call healing to our community, especially with regards to health equity and equity issues in general. So it is such a pleasure and really exciting to be partnering with the county on such an innovative initiative.
Nice, nice. Wow, thank you. So grateful to have everyone here. All right, well let's go ahead and jump into some questions. If anyone has questions out here, please feel free to just shoot questions. If even after the session, you can always send us an email. We'll make sure we'll provide that towards the end. But I think we have some questions that people have been ready to give out to us. So Nicole, if you would feel free to shoot us any questions that you may have that you may see.
Absolutely. So we'll go ahead and get started with our questions. So question one, who is this funding opportunity for?
Ooh, great question. So both is strong. We are accepting applications for any and all persons, any group of people that are journalists, social influencers, and or artists. That's kind of like the general consensus of who we are, but for all people. All right. Hope that answers your question.
Yeah.
Absolutely.
And there's more sort of an emphasis on people of color, artists of color, influencers, those who, provide alternative messaging anyway,
Mhm.
in ways that are really effective in marginalized communities, what are called the global majority. Um, we want to hear from you because we know a benefit to city and county agencies in the long term. So we're going to start with it now.
Excellent.
Love it.
Sounds great. So, alrighty, that brings me to the next question. So, what exactly do you mean when you say artist?
Hmm. Andrew, you got that one?
Sure, I'll go for it and fill in.
Okay.
Help me out.
Uh-huh.
So the opportunity is open to visual artists. So those of you who create things with your hands and your, for people to see and feel. Also performing artists. So when we talk about visual artists, we talk about paintings, we talk about sculpture, we talk about um, again, something that you can experience with your sight and potentially other senses. Performing artists are spoken word artists, are musicians, people who actually do performance art and for the sake of speaking on a concept. But the opportunity is limitless with regards to how you classify as an artist. Someone who creates and shares a message that connects to the everyday, the ordinary person in order for that message to reach the masses. So we're looking at painters, sculptors, musicians, dancers, and more. No specific genre and no experience is required.
Sounds great. Oh, we actually have a question here. It says, we are a nonprofit organization hosting a mental health awareness week at a middle school that will address COVID-19, involving stories about how they were affected and overcame this pandemic. So would this project be eligible?
Oh, wow. I think I can take this question. I would say absolutely. I think that these type of events are extremely eligible. Obviously, this is very creative. I mean, we're dealing with the mental health awareness week at the middle school, dealing with how we are addressing COVID-19, telling stories, talking about how you overcame the pandemic. The only thing that we would say is that applications are open to all people that are ages of 16 and older. And so if I would highly recommend whoever's asking this question to go online and complete our application. We also do have physical applications as well that can be found at our Durham County Library. And so, but yes, this sounds like a great project. I hope that you apply. See what happens.
And Be
Thank you.
Connected Durham will be at the library on Tuesdays from 3 to 5 each Tuesday, just to provide some support for those who need a physical application. But those applications are there behind the main desk, around the main entrance. And it's really exciting, this particular question, because these are the stories that have upheld the community, the type of stories that have upheld the community throughout the pandemic. So we want to hear them. They don't normally reach the masses. So yeah.
Awesome.
Thank you. Thank you so much, Jason and Angel, for those answers. Another question here. So, can I collaborate with someone on this project?
Sure, absolutely. Applications require a primary contact and additional information about collaborators' roles. Like, so make sure that you do provide that. Collaborations are absolutely encouraged. And if you, if this helps you to tell your story better, collaboration is key, in my opinion, especially after having experienced the pandemic. And so please do work with a group, work with a partner. Um, because not only will you have the support that you need, it does provide a better opportunity for your story to be told.
Love it. So collaborate, everyone. Collaborate, collaborate, collaborate. Work together. Definitely encouraged.
Absolutely. Absolutely. Thank you. Um, so, what are the funding amounts for this project?
Okay. I guess I can take that one. Pretty simple. There will be 4 awards. 3 of those will be for $5,000. That's right, everybody. I said $5,000. And then there will be 1 award that will be for $15,000. So make sure as you are drafting out your projects, that you're either going for the $5,000 award or you're going for the $15,000 award. There's like Angel said, there's room for collaboration. So a lot of different things. So, but we just ask that you apply for any award that you want to go after. But those are the award amounts.
Yeah, and I would just add to on the questions that ask you to give an idea of your project. It doesn't have to be a fully developed idea, but to think about the amounts as you're writing out the idea, even if it's in list form, so that there's somewhat of of a budget narrative associated with your idea, and that also helps us as we are looking at your application. So.
I love that. Great ad. Great ad.
Absolutely. All right, another question here. Oh, great question here. So if I am not selected, will I have another opportunity to apply?
Great question. Angel, you want me to take this one or do you want this one?
Sure, go for it.
So yes,
Oh, yeah.
wonderful people. There will be another. We are definitely planning a second round, so there will be another opportunity. So if you are not selected for this round, do not be discouraged. There will be another opportunity, another round that we are planning to do. So there will be further dates disclosed. The amounts will be disclosed at a later date. But we are looking to do this again. So be encouraged. Apply for this round. Like I said, if not selected, please apply and stay with us for the next round as well.
This is the first time, y'all, and it's
Mhm.
it's such an opportunity to figure out how to do something new and to support
Mhm.
more people and to encourage more people to create. So do not be discouraged. Your applications and commitment helps us to figure out what needs to be done in the future. So that's another reason why I'm excited about this.
Oh yeah.
Just getting started.
Yes,
Oh yeah. I couldn't agree more.
yes, yes. I see the excitement on the faces. Absolutely. Another question here. On your flyer, you mentioned project topics such as health equity, medical trust, health misinformation, impacts of COVID-19, and mental health. So, what do some of these terms mean?
Ooh. Wow, great question. Whoever asked that question, that's pretty intense. I love it. Um,
Absolutely.
let's see. Angel, want me to take this one or you want to tackle? We can tackle it together.
Sure, I'll get started.
Okay, let's do it.
Yeah, let's tag team. I'll start out with medical trust and health misinformation, specifically because of some of the experience we've had on the ground with Be Connected, working in the Hayti community or the Fayetteville Street corridor, which is what a lot of people know it as. We hear the stories about people. If you get the vaccine, you're going to be carrying a microchip. We also hear the stories about the past, like medical abuse in the past, the Tuskegee experiment, and we recognize that people have valid concerns about
Mhm.
medical trust. The reality is the novel coronavirus is called novel for a reason. And so that means we're still learning about it, which means that we don't have all the answers. Nothing is an absolute. However, it's important the scenario possible. And so we hear those myths so that they can be dispelled. We want to hear those myths because they also there might be more to look into with regard to some of the stories that people hear, and that's why it's important for us to expand our audiences. So that's what I'll say about medical trust and health misinformation, because there's so many wonderful things that have come about because of the pandemic.
Wow. I think great point. I think I would just speak to like just health equity in general. So like in terms of like health equity, we're speaking of working just create good, positive, um, health outcomes for everyone. And I think that's the part of equity. We're talking about everyone. And so make sure that we have a health equity lens when we're creating projects and things of that nature. And essentially mean that we value everyone equally, recognizing and correcting historical injustices and providing resources according to need. And so I think Angel did a wonderful job dealing with medical trust. And then so obviously as we address misinformation, as kind of Angel was also alluded to as well, a part of this project and part of Bull City Strong in general, we aim to share vital and accurate public health information in ways that reflect Durham's diversity. So we just invite you guys, everyone that's listening in, to just share, we invite you to share information about proven prevention strategies that will continue to keep the Durham community safe. And I think that's the big thing around that. So when you hear these topics about health equity, medical trust, misinformation, those are the type of things that that we're talking about. And so once again, we want to fund these projects for you to tell your stories about your local stories about community health, resilience among Durham communities, and also during the COVID-19 pandemic. So we can't wait to hear your stories, y'all. Cannot wait to hear your stories. What else we got, Nicole? Anything else?
Yes, we actually, I think here we have one more question.
Okay.
I see, what's the current timeline of applications and when will awards be announced? Great question here.
It is.
I can pick up here, Jason, and please do continue to fill in. So the applications are due January 31st, 2023. So we have a couple of weeks now, a little over a couple of weeks. And awards will be announced on Friday, March 31st. For funded artists, journalists, and social influencers. And so you'll have until June 30th to plan and implement your project once notified of your grant.
Nice. Awesome. That's pretty clear. I think just so everyone knows as well, everyone's listening, we do have flyers that are going out via email, and there's stuff on social media. Angel also mentioned that on Tuesdays we're at the library. So if there are further questions that people have, they can reach us there. But I also want to mention too as well. You can also email us, our team here, at bullcitystrong@dconc.gov. That's our email where you can reach out to us. Many of you guys have already been emailing us, but I just want to make sure that you guys have that email address available for you guys so you can reach out to us if you have any questions anytime. But yeah, I just want to make sure we say that. Nicole, do we have any other questions, or is that pretty much it? What do you have? Anything else?
Nothing else. I think this concludes our questions that we have gotten for today.
Awesome. Awesome.
Yay.
All right.
This was great. Well, yeah. Go ahead, Angel.
Feel free to reach out, as Jason said, via email, via social media, ask the questions. Please do apply. We want to hear from you. It's such an exciting opportunity, and honestly, we can't do these kind of things without applicants. So shoot your shot.
That's right. Shoot your shot. Apply. I just want to say thank you to Nicole. Also, thank you to Angel and Be Connected Durham. We are having a wonderful collaboration here, working together with the intent of really empowering our community and listening to the stories, learning from the community, learning from the stories. We cannot wait to meet you all, to see applications, and just look forward to hearing you guys. I think that really concludes our information session at this time. But we look forward to chatting with you guys. Take care, everyone, and hope you all enjoy the rest of your day. Take care, everyone.
Take care.